Everybody, and welcome to our Patient Online webinar. We're looking at using Patient Online, particularly record access, in standard diabetes care in the practice. Now, we've got about an hour for this webinar. We may, however, finish early if you don't give us enough questions. You'll see on the bottom left of your screen a little green box that says send, and beside it there's a space. Please put your questions in there, type them in as we go along, and we'll collect them and then answer them all by the end of the session. So today we have three of us, as you can see in front of you. I'm Dr. Ralph Sullivan. I'm the RCGP clinical champion for Patient Online. I've been working at college in this area for about 3 years. And in fact, it's now 12 years since I introduced record access in my own practice in the Yorkshire Dales. On my left, I have Joyce Pickering at the far end of the table. Joyce is a practice nurse and a Queen's nurse from South Devon, and is co-lead of the local Advanced Diabetes Forum. And beside me is Nutan Patel, who's a GP in Manchester and an RCGP clinical support fellow working in this project with me. So what are we going to talk about? Well, having record access can have an impact on patients' care. If they have diabetes, they can gain considerably from being able to see what's on their record. And the next slide really, it's a quote from a patient that I think really sums it up very nicely to me. I'll just give you a second to read those two paragraphs. This is person-centered care, isn't it? This is the patient being able to work out what matters to them, being able to see in their records the things that are relevant to their healthcare, understanding where they stand, and being able to say, this is my priority, so that when they are talking to their nurse or doctor, the conversation is at a different level. It's much more two experts coming together in the same room. So today, our purpose is to look at reasons why you might choose to recommend Patient Online. I've used POL, P-O-L, as an abbreviation for Patient Online throughout the slides so that they're easier to read. So how can POL, Patient Online, improve self-care for patients with diabetes? It's very important that patients manage their own diabetes. They need to know what their goals are. They need to know whether they're achieving them, and they need to know what to do to reach them if they're not on target currently. Patient Online record access can also improve the efficiency and the quality of care that you are able to provide to your patients, but we must do it safely and securely. So that is really what we hope by the end of this webinar that you will feel more confident about. If you're really interested and want to know more about Patient Online, there is a suite of guidance materials, e-learning, forms that you may use, patient leaflets, all on the same place on the RCGP learning website. And the URL, the web address, is at the top of the page there. So this is how we're going to go about it. We're going to quickly run through what Patient Online is for those of you who may be new to record access in particular. Where does it fit in with standard practice diabetes care? A very important reason why patients want to see their records and why they benefit is they can see the results of their lab tests, and we'll explain where that fits in to patient care. And by seeing the results, patients can come to consultations prepared with more knowledge and understanding of their own health than they'd otherwise have. So at this point, I'd like to pass over to Joyce to run through Patient Online for people who are new to the system?
So whilst I realise that many of you may have a very sound understanding of Patient Online, I know that some of my peers and other members of the practice team may not be quite as up to speed as others. So it is a toolkit of guidance and support materials. There is a wealth of knowledge and very good information that you can download on all aspects of this particular toolkit. It's not just for GPs, it's for the whole practice team. There is information to guide admin, staff and nurses down to healthcare assistants. The resources there can inform the team to try and raise awareness of Patient Online, can make them feel confident so that they can speak to patients and have a good understanding and engage with patients to promote this toolkit. There's also information that can empower patients. As Ralph has said, diabetes patients, lots of them have complex comorbidities, and the more that we can increase their understandings and empower them, obviously it gives them a better chance for better outcomes. We work closely with the RCN and other Royal Colleges and other voluntary sectors to make sure that there's a wide influence on these materials and that they are patient friendly and easy to work with. We try and engage practice teams and increase the awareness of POL throughout general practice. So what is currently available for patients? They can book and cancel appointments, and this is very popular as patients can access their at any time, so on a weekend or an evening using their phone or laptop. They can order repeat medication, and since electronic prescribing was introduced, this has become a very slick process and is very popular with patients. Patients can ask for their detailed care record, and if you look at the diagram below, there are 10 areas of their health record that they can access, and this has lots of benefits to them, particularly for practice nurses, things like immunisations, which sometimes can get lost when notes have been transcribed from patient to computer records. Patients can also ask for extended record access to either all or part of their medical records. And although this is gaining a little bit of momentum, you can see from this slide that more work needs to be done, particularly for patients who want their detailed records. Ralph is involved in this survey, which was done almost 2 years ago. And from this, it was a SurveyMonkey style of poll, and he got 211 responses back. As you can see, there was a wide influence in people who did respond, and they were asked to tick three boxes that they felt that they could offer record access, why it would be good for their patients. And this shows a breakdown of these. And for those of us who are involved quite heavily with diabetic patients, you can see that most of these are very relative to the care that we offer our diabetic patients. So how do patients actually start the process? It's very important, as Ralph said earlier, that patients have a good understanding, and that any record access application need to understand the safety and the importance of keeping their details private. The patient would have a good chat with a member of the team so that they understand what they might say, what they might not say. If there was any surprises, they would need to know if they saw some abnormal results or some information that upset them, who they would go to and how that process would work. This should be backed up with some written information so the patient can take that home and have time to digest that. It's very, very important that they understand the coercion question. So do you think that you may come under pressure to give access to someone else unwillingly? Once the patient has completed the form and the person that's guided that patient through are happy that they have understood about coercion, the records would then be checked by the GP. That sometimes can take a little bit of time. Obviously, we know in general practice that people can be busy. But I think if the patient understands that there may be a week or two's delay, and that gives the GP a chance to make sure there's nothing that would be alarming for the patient, and also time if there was something that he might want to call that patient in or she to have a chat. Once everything has been checked, the patient's identity would be checked and their login details would be given and agreed access would be switched on. So in summary, I know it's a very quick whistle-stop tour, but there's lots of information on that website that Ralph spoke to you about at the beginning. So it is a resource for patients and clinical staff to provide high quality care. It's an online service for patients to access medical support at a time that is convenient to them. Although numbers are increasing, more needs to be done to encourage patients to sign up. So we're hoping through this webinar, people might engage and see the benefits that this will bring to their diabetic patients. It's supporting patients to take health ownership and hopefully increase their health literature. It's a 3-step process, and to register for online and to access their notes. And I will hand you back to Ralph.
Thank you very much, Joyce. Thank you. So, Nutan, diabetes care and record access, how do they go together? What's the process? How does it work?
Right, thank you, Ralph. Well, I'll talk you through that. So, as we all know, diabetes is very complex. It's associated with multiple comorbidities and micro and macrovascular complications. So no wonder it's a minefield for some patients to really understand in depth their condition and why they're on all their multiple medications and why they need to be regularly reviewed. So it's really important that we try and give patients the best chance to understand their condition. If they have a good understanding of what diabetes is, how the treatment that they're on can help, and how improving their lifestyle can also improve their diabetic control, then it makes sense that they're much more likely to be involved in their healthcare. They're much more likely to take ownership of their healthcare, and ultimately that will lead to better outcomes. By having access to their online record, every time they log on to their record, they will get to be more familiarized with the names of their medications, the names of their other health conditions, as well as diabetes. And this ultimately improves their health literacy and makes them a more well-informed patient. If they're more well-informed, they're more likely to be able to take part in the discussions with their healthcare professional. And actually, the decisions made moving forward will be shared decisions. It really just empowers the individual to take a more active role in their health condition. And this can be related to all long-term conditions, not just diabetes, but for today's purpose, we're going to be concentrating on diabetes. So there are different types of record access that we can offer our patients. Many practices are offering transactional services. So that is access to online appointments, so making and cancelling appointments online, and online prescriptions, so requesting their repeat prescriptions and keeping track of their medications. But actually, as of 2016, it was recommended that all GP practices also offered access to detailed coded records. So the coded records include things like the names of their health conditions and diagnoses, a list of investigations or procedures that may have been carried out, their vital signs such as their blood pressure and the heart rate, allergies, past medical history, etc. Also, by allowing the patient to access their medical record, their coded records, the patient themselves are able to go through the record and make sure there's no inaccuracies or that there's no information that's been missed out, for example, an important allergy. The patient themselves can't alter their health record, but they can always, if they notice anything that's incorrect or that's missing, they can bring that up with their healthcare professional and we can alter their records for them. So it just improves the accuracy of their health record. And Lastly, the most detailed record access that we can offer is full access to clinical correspondence. So that's the transactional services, the detailed coded record, but also access to any free text in the consultations, and also their clinic letters, their document letters. Also, as we will cover a bit later on, online record access can give patients access to care plans, which might be in the form of free text in a consultation, or it might be in the form of a plan agreed with their endocrinologist in their clinic letter. So by allowing full record access, they're able to access these care plans, which ultimately will have a positive effect on their health care. So this is just an example of the type of information that a patient will have access to if we offer them access to transactional services, but also their detailed coded record. So I'll give you a bit of time to just look at this slide, but it's all very common things that you would expect to see on the health record of a diabetic patient. So I'm now going to move on to how having access to a patient's test results can help improve their diabetic control and their self-management. So the types of results that patients will commonly have access to, well, a diabetic patient will commonly have access to, are the following. It's all very common information that I'm sure you're all very aware of. But who ultimately is responsible for viewing and acting on these results? So, sorry, I'm just going to go back to the previous slide. I just wanted to quickly touch on the main benefits of offering access to test results online. So some of the main advantages would be, first, easy and fast access to the results. So sometimes patients are waiting 2-3 weeks to see their healthcare professional, and they've been asked to come in to discuss an abnormal test result. That can cause quite a bit of anxiety. So actually, sometimes it could be very helpful for them to be able to access their result earlier online. And if they understand that result, then it could be very convenient for the patient to have access to that. It also means that if the patient was accessing healthcare elsewhere, so if they were traveling or if they were attending hospital, A&E or secondary care, they'll have easy access to their previous test results, which they can share with healthcare professionals. And lastly, one of the main advantages of accessing test results online is that the patients can look up their results before their next consultation. This allows them to prepare for their consultation and focus that consultation on any queries that they might have surrounding that abnormal test result, or even the normal test results. So moving on to viewing and actioning test results. So abnormal results that can present in different ways, and it really depends on the computer system that you're used to and that your practice has adopted. So, for example, some abnormal results may appear in red writing, in bold writing, or they may have an asterisk beside them. Either way, usually the computer system that you're using will draw attention to the abnormal results. Now, be mindful that depending on the system that you're using, sometimes the patient might actually see that abnormal result before they've had a chance to discuss it with their healthcare professional. So it's really important that all the results are acted on a timely fashion. So we would normally recommend that when a test is being ordered, it's good practice to let the patient know roughly how long it will take before that result is available and actioned, so that they're not waiting and building up anxiety about when this result's going to be actioned. It's also quite important that all practices have a safe system in place to promptly deal with all their test results. So, for example, if a GP or if a practice nurse is on leave, there should be a safe, robust system in place so that the practice knows who is taking over responsibility of dealing with that doctor or that nurse's results. Also, some computer systems will allow the function to actually write messages to patients. So if, for example, a result appears as abnormal. So for example, if you had a cholesterol that was 5.6 and it was highlighted in red, it doesn't necessarily mean that that result was abnormal, because a patient's previous cholesterol may have been 6.5, so actually they're doing very well. But obviously a patient seeing a result in red may get quite concerned about that. So some computer systems allow us to write messages to patients so you could leave a message along the lines of cholesterol is improving, no concerns, or make an appointment in 2 weeks to see the practice nurse, etc. But this does depend on which system you're using. So not all the systems allow that function. Now, if you do allow patients access to their test results, do you know what they'll actually be seeing when they log on online? So, like I mentioned before, some computer systems will allow the patient to immediately have access to their test results as soon as they're available. So just be mindful of that. The patients are also, as we are able to, they're also able to view their trends, which is very helpful and again helps promote self-management. If they're seeing that they've started a new anti-diabetic drug and their HbA1c is improving, that's positive reinforcement, and that's very handy for the patient. And I think we've been through some of the other points already, so I'll move on to the next slide. So I always think it's very important when you're ordering a test to actually explain to the patient why you're ordering that test and what the significance of that test is in their diabetes control. Because without actually understanding why they're having the test, it's difficult to relate that to their condition. There are ways that you can go about this. So you can have a verbal conversation with the patient, but you can also provide a patient with a patient information leaflet when they sign up to Patient Online, which just tells them the common diabetic tests that are regularly carried out in general practice and what targets to aim for. You can also signpost them to online resources such as UK Diabetes or UK Lab Tests Online. Both of these also give a lot of information on why common tests are carried out and the ranges of targets to aim for. So I think we've already discussed about the trends, so yeah, I won't go over that part again. And I'll just touch again upon abnormal results. So abnormal results are not always harmful. And it is important to stress this to patients. This can be written in the patient information leaflet that you provide to the patient, and this is also covered on some of the online resources mentioned above. The RCGP have also issued a leaflet called Understanding Lab Results. It's a very easy to follow PDF file, and it's a useful resource for patients. It will be available shortly on the RCGP website, so that's another resource that you could have to hand and make the patient aware of when they're signing up to online access. Ultimately, though, abnormal results or dealing with abnormal results is the responsibility of the practice, and you need to make sure you have a safe and robust system for dealing with abnormal results. So although patients, you would expect that they'd be accessing their results online, an abnormal result, you might still want to have a system in place where abnormal results are either rung through to the patient, or you might want to send out a letter in writing to alert the patient to this. It's also possible to carry out an audit in your practice to make sure that any abnormal results or any results that have been actioned by the GP or by the practice nurse that information has actually been conveyed to the patient. And it goes without saying it's useful to get into the practice of completing significant event analyses if you do come across a system error that's had an impact on the patient care. And I'm just going to finish with a slide on proxy access. So proxy access is when there's someone else asking for online access for a patient because they're acting on behalf of that patient. So it's usually for family members or carers or anyone who has who has legal responsibility over that patient and their welfare. So if a patient's carer is applying for proxy access, they will need to have personal login details for security reasons. So they don't necessarily need to be a patient of the practice to gain this access, but they do need permission from the patient to get access to that patient's notes. Now, not all patients are able to give consent. So, for example, if you have a patient with dementia or a young child or anyone that you think doesn't have consent to give that information, it's actually the doctor's responsibility to weigh up the pros and cons of granting access to the proxy access. So, but ultimately the doctor will need to act in the best interest of the patient and make that decision. Children, I'll just briefly cover proxy access for children. So the legal guardian of the child will have automatic proxy access to their notes, unless in small number of cases, if there's any safeguarding concerns, that's a different scenario, which we won't cover today. On the child's 11th birthday, the computer systems should automatically restrict the amount of proxy access that the parent is granted. So the parent can still sometimes view the patient's record, but they won't be able to view everything on the record, such as free text. And this also goes for children between the ages of 11 to 16. But as soon as a child turns 16, so on their 16th birthday, proxy access is automatically switched off. Now, this is just guidance. Obviously, you have to take this on a case-by-case basis. So if there's any concerns about granting proxy access with an individual patient, you need to make the decision that's in the best interest for that patient. Now, we are actually developing guidance online for end-of-life care and for dementia, and there'll be a lot more about proxy access on these toolkits, which will be available soon on the RCGP website. Thank you very much.
Thank you, Nissan. That's really, really helpful. I hope it's been useful to people logged into the webinar. Now, we've talked about the theory about how Patient Online works, how you can implement it. But I think it's really important to finish off this session with a real-world description of how it fits into the standard routine way that we provide diabetes care in general practice. So, Joyce, may I hand over to you to cover that?
You may. Thank you. So we've heard a lot from Nissan about what is available for patients who have full access to their records. I'm going to talk a little bit about care plans and the improvement that can be made on these by patients coming to a consultation, haven't had time to digest the information, the latest blood tests, or if it's been a letter from the dietitian or podiatry. And that gives them a chance to discuss it with family members and give them time to think, well, what is important to me? What do I want to take to that consultation? What are my main concerns? So when they come much more geared up and much more positive about making informed choices, having an understanding from hopefully seeing these trends. Are things getting better? Are things getting worse? Quite often, patients, if they don't have a care plan or they're not so well informed, they can be quite anxious coming to the consultation, wondering, is it higher, is it lower, will I have to have more medicine, I'll have to go to the hospital, and that can cause quite a lot of anxiety. Patients who are anxious tend not to articulate things quite as well as they might when they're in their own relaxed environment. So having that additional time to, think things through, they can come well armed for a proper discussion, and that makes it far more patient-centred and far more positive for the patient and the healthcare. That engagement is worth its weight in gold. So what is a care plan? A care plan is a written statement to improve health outcomes. It's two-way engagement, so it's got to focus on the patient, and it's obviously got to have some clinical input. And I think through discussion and through the patients, taking more ownership and improving their health literacy, these can be valuable. As Natan said earlier, they come in many different ways, and lots of information can go into a care plan. This is a 6-step cycle, and patients can enter that at any stage and then just follow it around. And as they come every 3 months or every 6 months, this can be a reminder when they check back what is on their records as to how they're driving, how are they getting on, are things getting better, was there something that they'd said they'd do, could it be lifestyle change that they had? And then that personalised, patient-centred approach fits in very well with the Year of Care Partnerships advice. There are lots of information out there. There are lots of places that you can signpost your patients to. There's NICE guidelines, Diabetes UK. There is a plethora of sample patient care plans on the website. So if the GP or the nurses who are having that conversation are a bit struggling for ideas, there is plenty out there. But the key thing is it's got to meet that patient's understanding at the time. So sometimes it doesn't have to start very complicated with every input, the retinal screening. It can start with quite basic things and get the patient engaged with that. And then as time goes on, more can be, as they grow, more can be inputted. There is effective evidence, sorry, I'll say that again. There is evidence that care plans can be effective. Most of us in general practice are aware that patients with long-term conditions take up a lot, over 50% of GP and practice nurse appointments. Of that vast figure, only 3% have an agreed care plan. So there's obviously room for manoeuvring. Obviously, this is looking at COPD, it's looking at asthma, different long-term conditions. But whatever the long-term condition is, if you can engage patients and you can work together to help them take some more responsibility for their own health issues, it can have a very positive result. So of that 3%, the majority found it a useful tool. And the big advantage of that care plan being online is that they won't lose it. I'm sure lots of us keep writing the same things out because it gets lost or it gets tatty or whatever. And they can refer to that at any point. And if they have got problems, as Natan was talking about Proxy Access, then they can have support from their family or carers. It's a little bit disappointing that 29% said that they had no input at all in the plan. And best evidence would show that proper engagement leads to a better outcome, and that plan then becoming a working tool, a living document. So if you are thinking, okay, this is all really good and I'm really fired up now and I'm going to start setting up some new care plan templates, then these ones on the screen would be an excellent place to start. Diabetes UK, don't know if you're all aware, but clinical oops, don't know what I did there. Clinical staff can take out a membership, and bi-monthly you will get all the latest advice on insulin pens and monitors and really useful stuff that can be a bit of a minefield because these things change so fast in the world of diabetes. Obviously, there's NICE, and there's a lot for anybody who wants to look further afield. NHS Scotland do some excellent diabetes resources. So a little bit of a summary. Improved diabetes consultations with this new online access for patients who are going to sign up for that, the potential to reduce demand on appointments. So there's less making appointments by phone, and obviously if we're titrating medication, if the patient has a written advice saying, well, if my HbA1c is this, then I don't need to do anything, you know, they can just rebook for 3 months' time. It promotes health ownership, improves health literacy, and regardless of who that person says, it offers a consistent approach, so that if the regular diabetic nurse or GP was not available, all the input would be there to help support that patient. There's evidence to show patient and family benefit can help people support one another, and there is evidence to show best practice. And with that, got too far, I will hand back to Ralph.
Thank you very much. Well, I'll just pull this together now. We've nearly come to the end of what we have to say in the presentation. So we've been talking about online record access in diabetes and how it reflects the theory and the presentation of a person-centered approach to care of patients, how it supports patients to look after themselves. There is the benefit that patients can see what's in the records, they can understand better why decisions are being made. It improves trust, which is so important and is at the very heart of the relationship between patients and their health care professionals. It's incredibly useful for people who are caring for patients, for their family member, in any legitimate circumstance. Record access, even being able to request prescriptions, can be very helpful to carers. The record can be shared. The patient can make a choice to share that record with other people in the team. If they go to A&E, we've talked about people who are traveling away from home on holiday. It's a way of healthcare professionals in other parts of the country or other countries being able to access the most critical information about the patient. And it does have that impact of improving the record quality that the practice has. Patients can see that something's been missed, maybe hasn't been summarized from a previous practice. Record quality tends to improve with all the benefits that go with it. So that's what we have to say. I hope it's been interesting and useful. We have a few questions that we'd like to go through. Actually, more than a few, I think. May I? Right. So first question is a good one, and I think it's quite clearly for Joyce. How can GP nurses become more involved in this process?
I think in a lot of places across the country, diabetes clinics are more and more nurse-led. We generally have longer appointments and more of them with our diabetic patients. And that gives us a chance to build up a relationship with that patient and makes it quite easy to have that conversation, just to go through what would the benefits be, would you find this helpful, and start to sow the seeds and maybe give them some written information. I think that nurses, we're very keen to use these new tools to try and reduce demand. Everybody in general practice is struggling to find appointments. So if we can reduce that and improve our patients' health, then that's got to be a good thing.
Very good, thank you. The next question is, does this completely replace paper care plans? Go on, Natan.
Yeah, I was going to say, no, it doesn't completely replace paper care plans, because not everyone will opt for full access to their notes, although we do want to be encouraging and emphasizing the benefits of access to patient online. But some people may still not feel very comfortable with using the online system. Some people may still want a paper version of their care plan available at home. So it's actually supplementing or supporting the option that they choose that best suits them. And there's lots of different forms of having a care plan, as Joyce has mentioned before. So it might be free text in a consultation. It might be a paper care plan that you've scanned into the notes that the patient can have online access to. Or you might still stick with the previous paper version if that's what the patient opts for. So patient online is more about working with the patient to find a medium or a system that best suits them. So working together really and working with the patient's preference.
Yeah. Thank you very much. The next question I think falls to me. It's nice and tidy, isn't it, going around the table? How is the risk of the individual seeing sensitive information which they might be surprised or upset about reduced? We have got quite an extensive piece of guidance on the Patient Online Toolkit on the RCGP website that goes into depth about this. I think there are a number of things I would highlight. Starting with when a patient registers for access, as part of the discussion about record access, it is to say that actually, if you see the record, you might see something that's very technical and you don't understand. You might find it upsetting. You might even misunderstand it and think you've got something seriously wrong. You may see something that you're surprised with and disagree with nevertheless. You might see an abnormal result and even a suggestion that abnormal result might be quite dangerous before a diagnosis is made. The most important thing is to have an agreement with the patient about if something they see surprises or upset them, how to contact the practice, what process the practice will go to discuss it with them, and so that the patient feels confident and comfortable that they're not going to be left out on a limb with something frightening on a Friday night and not able to talk about it until the next week. That's one thing. Accurate and good quality records are important. And once you start to give record access, I think it's important that everybody in the practice buys into the process of looking after the quality of the record and just being aware of what they write. Perhaps the classic example is where you might, in an individual patient's record, write something about someone else that might be confidential. And so that might actually appear in a letter. And if you're giving access to clinical correspondence, just beware of that. If there is something that has to be in the record that you think could be harmful, it may be a history of a genetic condition. It might be that you're providing access to somebody who is subject or has been subject to abuse in the past and you don't want to refer to something, you can actually hide those potentially harmful items of data. How you do that depends on which system you're working with, but they all have some way in which you can hide that data from being seen by the patient. You can still see it in the practice, but the patient won't be able to see it. We call it redacting the data. And the last thing about sensitive information too is to respond in a listening manner when people come to you with a concern about what is in the record. You have to be open and have a good relationship with patients about this. The worst thing of all would be getting into an argument about whether some data should be in the record or not. It's up to the practice about whether they change a piece of data that the patient disagrees with. But and generally speaking, if it's already in the record, I would recommend you leave it. But you might add an annotation to it to say the patient disagrees with this information. And that's quite a good compromise if you do get into a particularly difficult disagreement about a particular diagnosis or a statement of some sort. So moving on, next question. Can all patients that have patient online access their results, or are there some features opt-in, opt-out? Who would like to take that one?
I don't mind. So it depends on the level of access that the patient has requested or that the practice offers. So the basic level of access, like we mentioned before, would be access to online medications and online appointments. The next step up, which is what we should all be offering, is access to results. But not all patients will request that access. And if they do request access, then yes, they would have full access to all the results. But as Ralph mentioned earlier, if you think there's a result that's particularly sensitive that you possibly wanted to have a discussion with beforehand, before the patient sees the results, you might want to discuss it with them face to face, then you can redact that information. So you can hide the information, have that discussion with the patient face to face or over the phone, and then make the result visible. I hope that answers the question.
I think that answers the question to me. I think this one, sadly to say, this is a question for me. Is patient online up to date with GDPR? Patient online on its own is not relevant to GDPR in many ways. GDPR does not have a special relationship with patient online. Patient online is based on consent. It's the practice giving consent to the patient to have access. It's the patient giving consent to proxies to have access on their behalf. There is no consent involved in GDPR for practices to make records. Consent is not the legal basis, but the practice is expected to keep accurate, up-to-date records and to be able to report to people what is in their record. That's not really fundamentally different under GDPR and the old Data Protection Act. So in that sense, no, the GDPR doesn't bring any new criteria to general practice and to patient online. Specifically, there are things for general practice to do. So can I move on? How would patients correspond with practices regarding results discrepancies in the record? So if patients saw something they weren't happy about in their record, something that upset them, something they disagree with, what would they do about it? Joyce, can I? How would the practice contact you? How would the patients contact you?
Patients, there are many ways. So patients can email the practice. Obviously, if it was something they were very worried about, obviously we have an on-the-day service. I would like to think that at the start of the process, when that patient was signed up to Patient Online, they would have been given practice-specific information on what to do and such, because it would be quite unfortunate if a patient was quite far down the process and then got something and wasn't sure. So that will vary from practice to practice, but they should follow the guidance that they were given. And if it is something urgent, then obviously they could ring the surgery, or less, if it was less urgent, they could make an appointment to come in and discuss it. Hopefully, they may have had a written care plan, and it would be they could refer to that if it was, because we're thinking of diabetes in this particular webinar, then they could maybe see within that scale, if it was way off the scale, then they would have to act promptly and contact the practice.
Right, another question here. Is there any evidence of people not attending review because they can access their results online? Either of you have experience of that happening? Patients not coming for a diabetic review because they can see their results online. Do they use their second appointment as normal?
Sorry, go ahead.
not particularly with them, but if they've had access to their results, possibly they've, in between having their blood test done and coming back to see myself, they may have had to contact a GP for something else, and they'll have said, "Oh, are my results back?" And if the problem with that is they're not just coming back for the results. So I think we need to educate our patients that it's not all about the blood results. It's not something I have experienced, but I could see why the person's asked that question.
I think that's right. It's patients' expectations, and if they think that second visit is purely to discuss the results and nothing else, then they may not turn up. So this is a matter of educating the patients about what the next consultation is for. So it's patient expectations, I think, really, rather than something specifically around patient online that one needs to think about.
Could I just add to that?
Please do.
But I also do think it's, as a practice, we would have the responsibility overall to deal with any abnormal results. So if there was an abnormal result on the patient's notes and they didn't, and you had advised them to book an appointment and they didn't come back for that appointment, perhaps because they didn't quite understand the relevance of that result, as a practice, there must be a safe procedure in line to follow up those abnormal results or the results that need actioning or urgent actioning.
Right, thank you very much. I hope that answers the question. And for the next question, I'm just going to move back on the slides to something at the beginning. Gone too far. The next question was, how many people have signed up to the patient online record access so far? And how many of these patients have got diabetes? I'm not sure how well you can read this slide. It's taken from the NHS digital website, and it's from a part of the website called GP Data Hub, where the answers to those questions, as far as they exist, can be found. This is a public a piece of the NHS digital website. You can go and look at the national figures. You can go and look at the CCG figures, and you can actually go and look at your practice figures. And it tells you about the percentage of the population of England that have registered for the different services within Patient Online. And you can see that the yellow and the blue are at about 23%. That's appointments and repeat prescribing. That's 23% of the English population in total. If you think that people with long-term conditions, the numbers are significantly below 20% of the population from young age to old age. So people on repeat prescriptions are signing in extremely well. For record access, the numbers are much lower, 4%. Although there is a lot of variation between practices. And in my own practice, we've got to 16% without any difficulty at all, simply by starting early. We've been doing it for more than 10 years. There are no national statistics, as far as I'm aware, that breaks down these numbers of patients into what conditions they have. I just do not think the work has been done. And in fact, until very recently, the system suppliers have not been providing much data at all about the uptake. Some have, some haven't. It's not across the board. We're only just beginning to get reasonably accurate numbers for the numbers of the population who are actually signed up. And that's the best I can give. But do have a look at the GP Data Hub on NHS Digital's website if you're interested, and you'll see more about your own practice there if you wish. So, moving on to the next one. How can we use practice participation groups to develop patient online with the respective local population? Well, I've certainly got experience of doing that myself. And it worked very much like using the participation groups in other areas of developing the practice. In fact, it actually comes the other way around, and the practice participation group will say, we can help you with this. This is good. We'd like to do something in this area. and I'm sure we've all had experience of how participation groups work. Joyce, do you?
Well, we certainly encourage them to take an active role, and we have used them to try and get patients aware of Patient Online. And one of the ways we did this was by inviting some of them to come to our walk-in flu clinics, whereby we'll do about 2,500 patients over 2 days. So they're very busy clinics, but there's a lot of footfall. So obviously, one of the, I think it possibly was a practice manager, it wasn't myself, that went to one of the participation group meetings and explained the procedure and went through the literature. So they weren't responsible for actively signing patients up to Patient Online, but they had a very key role in highlighting the benefits and giving leaflets so that the patients could, take it further should they wish.
Thanks very much. Nutan, have you?
I don't have much experience of that at the moment.
No, that's fair to say. The last question then. You can hide items of data, but do you still have the obligation to inform the patient about your redaction? That's actually a very good question. I think it's quite important that you're clear about that. Would you like me to answer that one? Because I think there's a number of items come out of that. If a piece of information in the record is deemed to be potentially harmful to the patient, and this is a decision for the senior health professional within an organisation, then in the patient's best interest, you can justify not sharing that information. And it doesn't matter whether that's not telling them verbally, not showing it online, or not including it in a subject access request, which is something under the Data Protection Act, where a patient can say, please give me a copy of everything you have about me in your records. You can withhold that record or a part of it quite legally and quite legitimately if you can argue that it's not in the patient's best interests. That's what you can do. The other side of the coin is, what should you do? And I think every case needs an individual decision, and it's a conscious individual decision by a healthcare professional who feels comfortable about making it. Most redactions, I would argue, should probably be temporary until you get the opportunity to actually talk to the patients. And I would say that the main goal, if you redact a piece of information, is to get to the position where you can remove that redaction. The patient knows about it and everybody understands what's going on. Occasionally, you'll need to leave a redaction in place. But I think if you do redact something because you think it'll upset the patient, then do take the opportunity to talk about it. I think that's the best guidance, accepting that you almost must be wary that things can be harmful to the patient. Oh yes, there was one last comment that we got was that Proxy Access functionality is not yet live on EMIS Web. We've tried to talk generically about GP systems. There are differences between the systems. EMIS have been promising Proxy Access in EMIS Web, and I believe it's due to be rolled out very soon. Thank you very much. And can I say thank you to Nutan and to Joyce for joining me today. I hope this has been useful. Goodbye.
Bye.
Bye.